Myths versus facts. So everybody out there that watches the show on my 90th episode, again, we do something every week called Myths versus Facts. It's all about setting the record straight. Again, building trust and delivering truth. How it works, I'm going to say a statement, and my panelist is going to say myth or fact. They're going to explain why. We're going to kind of go bam, 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 keep this thing moving, and we'll see how many of these we can get in there. Myths versus facts. I love it. So here's the first statement. Dr. O'Rourke, here we go. Here's a statement. Myth or fact? Health systems nationwide will likely continue to be affected by COVID-19 for many months to come.
100%, that's a fact. I think it'll be different than it was when it first hit, but certainly at my hospitals, we have COVID patients in the hospital right now, and I think that's the case for many hospitals throughout Chicago and the country. So these are patients we're taking care of, and the disease is not going to go away. So it will definitely be a problem that we're continuing to deal with, and we'll continue to treat patients with that disease. That being said, like specifically for surgery, you know, when all elective surgeries were stopped in March, that was because of a lot of concerns, including the PPE and ventilator issue. I don't think those issues are likely to recur, even if there is a surge in the summer or fall, as some people think there are, because now, you know, we have many hospital systems have plans in place if those are to occur, and we're a little bit more prepared. So I wouldn't expect an interruption in surgical care as occurred in March, but I personally expect to continue taking care of COVID patients probably into 2021.
All right, thank you. Here we go, Dr. Schmitz. Here's a statement. I was already diagnosed and resolved my COVID-19 infection. I still need to undergo, I still need to undergo COVID testing prior to my surgery. I guess it gets to the question again, does everybody still have to get a COVID test?
I think that's it depends on your hospital system. At my hospital system right now, it'd be a fact, but it depends on your hospital system.
Excellent. I agree with you on that one. Yeah, it would be a fact in my system too. Here we go, Dr. O'Rourke. I like this question. Oh, go ahead. Go ahead, Dr. O'Rourke.
Well, one interesting thing as testing has become more available, there's some question as to once you've had it and you've tested positive, then if you retest, some people, for whatever reason, keep shedding a small amount of the virus and can be positive for weeks afterwards, even when their symptoms have resolved. So that's a really interesting question. And it's like if you test positive a month after and you have no symptoms, whether that test means anything is an interesting medical question right now.
I like to leave let my infectious disease colleagues always weigh on that one. Awesome. Love this one. Here we go. Dr. O'Rourke, I'm coming right back at you. Here's a statement. My primary care physician must approve my surgical procedure. Myth or fact?
It depends. Depends on your health insurance, to be honest. I would say generally, no, strictly speaking, that's a myth that your primary physician doesn't need to specifically approve it. I would, as I think we said a couple times already, it's definitely a good idea to see a regular doctor and let them know that if you're having surgery so you can be prepared for it.
I think my patients that know me know that they got to come in and see me before their elective procedure. So if that's an approval, it is what it is. Excellent. Dr. Schmitz, here's a statement. I like this one. All right. It is okay for me to postpone my surgery. We just did this. It is okay for me to postpone my surgery until after the COVID-19 crisis is over. Myth or fact?
That's a fact. You need to be comfortable with getting the health care, and you need to be comfortable with having your surgery. So you can postpone it as long as you want, as long as you're not physically deteriorating from your condition.
Excellent. Here we go, Dr. O'Rourke. I like the system. I like this question. Sorry, not the system. I love the system though. Here we go. I will get in-hospital transmission of COVID-19 during my surgical stay. People saying they will get it during their surgical stay.
That's a myth. Hospitals are doing everything in their power to keep COVID patients and non-COVID patients separate. And certainly many surgeries are done where you come in and you go home the same day. So if if you were likely to get COVID while you were having surgery, I don't think any physician, surgeon, or hospital system would do surgery. So certainly systems are in place to prevent that.
Thank you. Here we go, Dr. Schmitz. I think we'll do a couple more. I will be required to wear a mask during the continuum of my surgical stay. Myth or fact?
That is a fact. I have to wear a mask to walk in from the parking garage to the hospital. So everybody that's in our hospital has to wear a mask. Now, there are certain times when you're in the recovery unit after your surgery, they're not going to make you wear a mask. But during your hospital stay, we are making the patients wear masks to try and protect various people. So yes, fact.
All right, thank you. Here we go. I like this statement, Dr. O'Rourke. All right. If you do not complete all preoperative testing, then you will not get surgery. Myth or fact?
Preoperative testing is designed to either optimize you or to evaluate your surgical risk. So certainly I would encourage anybody, if someone recommends they get some type of preoperative testing, to have it. Whether or not it absolutely would prevent you from getting it if you don't want to get it would be a conversation you would need to have with your physician.
Wonderful, thank you. And I like this last one. Here's this for you, Dr. Schmitz. Here's a statement. Health systems will coordinate the details of your drop-off and pickup with your support person before and after your surgery. Myth or fact?
That's a fact. Our perioperative folks have been absolute all-stars. We switched from having this massive in-person pharmacy that seemed to always have a two-hour wait to a drive-through pickup pharmacy on orders of a day, and so our folks have been absolutely wonderful in coordinating your perioperative medications, making sure that you're getting wheeled down to your partner picking you up. And so that's an absolute fact. The hospital's going to do everything they can to make sure that you have a great experience and a healthy experience.
Wonderful. There you go, guys. Thank you again. Myths versus facts. Love it. So we got about 5 minutes left, guys.